Restless leg syndrome. Restless leg syndrome is the syndrome in which the patient feels uncomfortable at rest. Restless leg syndrome. Restless leg syndrome. In the restless leg syndrome, the patient feels restlessness at rest and relieved when moving. Patient feel restless, restless, restless at rest. The patient feel restless at rest and feel comfortable when leg are in action. That is restless leg syndrome. In this syndrome, the patient want to move the legs. Patient want to move the leg. Symptom begin at rest. The symptom begin at rest. The symptom worsen at night time because at night time the legs are not in action. The restless leg syndrome is associated with periodic leg movement. Associated with periodic leg movement during sleep. During sleep, the patient move his leg, lasting seconds to minutes. At lasting seconds to minutes, and they reoccur 5 to 90 seconds. They reoccur 5 to 90 seconds. Every 5 to 90 seconds. What is restless leg syndrome? The restless leg syndrome, the patient feel restless, that is uncomfortable at rest, and comfortable when legs are in action. The patient want to move the legs. The symptom begin at night or at rest and worsen at night, and the symptom begin at rest or at night and worsen at night. The symptom begin at rest or night. This is 90. The periodic leg movement occur during sleep and they last from seconds to minutes, and they reoccur every 5 to 90 seconds. And the sleep, there is poor quality of sleep because the legs are moving, the legs are restless, the legs are not comfortable. There is poor quality of sleep. Poor quality of sleep. There is poor quality of sleep. There are two types of restless leg syndromes. Number one is primary and other is secondary. So the primary restless leg syndrome. The primary restless leg syndrome is autosomal dominant disorders, but not the exact gene are identified. The exact gene are not identified. And there is secondary restless leg syndrome. There is secondary restless leg syndrome. The secondary restless leg syndrome is associated with pregnancy. They are associated with pregnancy, and they are also associated with anemia. They are also associated with ferritin deficiency, and they are also associated with the renal failure, and also associated with the neuropathy. What type of neuropathy? The peripheral neuropathy. Restless leg syndrome has the patient has poor quality of life, poor quality of sleep because the symptom worsen at night and the legs are in restless states, and the movement occur every 5 to 90 seconds, and they last from seconds to minutes and reoccur 5 to 90 seconds. And there are two types of restless leg syndrome: primary restless leg syndrome. There are autosomal dominant disorder. The exact gene are not identified. There is secondary restless leg syndrome, that is secondary. The secondary restless leg syndrome is associated during the pregnancy, during the anemia, that is when patient has anemia, ferritin deficiency, renal failure, and peripheral neuropathy. What is the other features of restless leg syndrome? What is the age for the restless leg syndrome? The average age is 27 years. Average age of restless leg syndrome is 27 years, but pediatric cases are also identified. Pediatric cases are also identified. The main age is 27 years. 27 years. The pathogenesis of restless leg syndrome. Pathogenesis. What is normality in restless leg syndrome? The pathogenesis is in the restless leg syndrome. There is the disorder of the dopamine function. Disorder of dopamine function. That is peripheral dopamine function dysfunction or central dopamine dysfunction. Dopamine dysfunction. The restless leg syndrome also associated with iron metabolism. Iron metabolism. There is iron metabolism abnormality also. Abnormality. That is main age is 27 years. Pediatric cases are also identified. The pathogenesis, there is disorder of the dopamine. There is dysfunction, that is peripheral or central dopamine dysfunction. They may be associated with iron metabolism abnormalities, and the treatment include for the restless leg syndrome. What is the treatment for restless leg syndrome? For the restless leg syndrome, we check the ferritin glucose level renal function test because they may be associated with renal failure. We check glucose, blood glucose, renal function test because they may be associated with renal abnormalities, and ferritin because ferritin deficiency can also cause restless leg syndrome. The treatment mostly no clinical significance. In the treatment, there is no clinical significance in mild cases. Mild cases, no need of treatment. In severe cases, when disturb the sleep of a patient or other abnormalities, we mostly improve the sleep. There is sleep hygiene. We improve the sleep and the sleep habits. And the medicine we give for the restless leg syndrome include pramipixole 2 to 3 mg, ropinirole 1 to 2 mg, rotigotine patch 2 to 3 mg. We give these medicine, that is pramipixole 2 to 3 mg, ropinirole 1 to 2 mg, rotigotine patch 2 to 3 mg, 1 to 2 hours before bedtime. 1 to 2 hours before the bedtime because we improve the sleep hygiene. Analgesics may be given for the pain, opioid may be given, and iron replacement therapy for anemia, that is ferritin deficiency. When there is ferritin deficiency, in the diagnosis we give iron replacement therapy to improve the symptoms. So this was the restless leg syndrome. The restless leg syndrome is the syndrome in which the patient feel uncomfortable the legs when he or she is at rest.